again, 3. We will start with the 3 at the very beginning after we wipe off the EMLA, because the deeper penetration more painful. So we start with another, this is 3 mm again.
Sao con?
Patients
ก็
ถามได้เลยครับ
600
test or even online ตอนนี้ผมจะยิงไปเรื่อย
con hả các bạn gái hay ai vậy?
Cái đây con thích giúp một người sao đó là
Thì con kiểm tra cái một người đó nha.
một kiểm tra mình, hai kiểm tra người kia, không phải
Một đâu chứ. Cái kia là nó dục rồi nè.
the chance of the and then the
Còn sau quan hệ toàn nha em. Có hay không người quen, không người quen thì cũng nên dùng bao nha. Hiểu không? Nhỏ nó không lây sùi mà nó lây cái khác nữa. Bác sĩ con thấy
I did not
viêm
use
gan
the
nữa.
fractional viêm gan CO2 anymore.
À, để lát em lấy thôi, để em
Not combined.
Have you tried
Understand.
the fractional RF and then moving like either one moving exosome
Về học chuyên thì
That one here.
The subject some growth factors activator on top, as Dr. Opia said. You can use the new exosome, the topical one. However, exosome is quite a still controversial issue, whether it is still stabilized or not, created the holes on the skin. So this is all the chemical that you are doing the meso. You can show for you. Apply and leave it on for 5 to 10 minutes after the chemical or the activator will slowly going down into the dermis. So that is a triple effect. For the chemical peeling, also the surface still the pore already. So the skin surface you can watch normal as ablative CO2. You can watch the face normally going out. So lastly, for the epidermal effect, like in this case, I might do the light peeling, the TCA or the lactic acid, little peel after 10 minutes and then leave it, go home, watch off tomorrow. Yes, please.
hoặc là nó nổi tiếp trong giai đoạn của nó đang nổi tiếp, nhưng mà bữa nay mình đốt những cái mà mình thấy nha, rồi nếu mà ngày mai hay là ngày mốt thì nó nổi thêm thì đó là nó đang trong giai đoạn đơn thôi, nó tiếp rồi giữ được sẽ là khắc phục
Although for at first, when you do the fraction of vitamin and then do my chemical PhD after because they will put the
lành nha,
and
giữ
then
vệ sinh á, đi vệ sinh xong thì
then you
phẫu
can
lại
compare
nha,
this.
phải một lót
You can
sạch
get
mỗi
one
ngày
first
2 đến 3 lần, hiểu không? Thay vì mình băng nó thì mình dùng cái quần lót để mà băng á.
If we combine this case for demonstration, so we wipe off to show you. Normally we put the whole face, forehead, and some on the neck with the EMLA. And then when you want to treat, I start with the cheek, then I wipe off the first part of the cheek first and do the treatment until finish. Then I'll go on to the forehead and area. With the area and wipe off the EMLA accordingly until we finish all the fractional needling. Then if you want to do the chemical massage, vitamin C on top, and then leave for
Cái này mua loại nhỏ thôi, tông về sát khuẩn hết.
5-10 minutes, and then clean it, thinking much because the hole of the needle already closed. And lightly put on the whole face at the last, and then leave it dry, and then tracing go. Might last 2-3 days according to your level of sensor. Then you can pump up the energy more, the depth of the needle, put more passes, so that you keep your patients with us. If you start with the very high fluence at the beginning, very red, very swelling, with some edema, and your patients did not have that kind of experience before, so that might scare them, and they will turn better. Oh no, too much for me, something like this. So I will always start with the lower setting.
Nói cho đỏ nè, không nói gì chắc là còn hả? Con mà.
Three. I will do on the nose as well. For nose, I do just one pass.
Ủa đấy cái máy lạnh
Mesotherapy or the chemical so far in Thailand, in our country. And did not check thoroughly by the Food and Drug, the Thai FDA. So what we are wondering is, are there any of that chemical or the real factors inside that vial or not. If we are trusted the company and you put it, of course, it will have the effect according to their claim. For example, if you use just only the ampoule of the vitamin C, that is like a quite documented. It's a simple vitamin C, and you write it on. It's worked, lightening.
For lifting effect, what the especially if you want to special lifting service, for example.
Oh, you mean the method for lifting?
Yeah. Tissue lifting and for morning.
For me, I use less of that injection because I'm afraid of the FDA. And so for lifting, we use the high flow or the thermage. That
the scars.
lift the scar. Pardon me.
The scar
Or so like special
factors here, like if you want to boost your
the results. You can use all the chemicals that you like, put it on. And also one more thing, I'll do the subcision, the needling with like a 18 or 21 gauge needle and do the subcision. For me, more quite a nice combination. Forehead and neck, also forehead is a thin skin. I prefer to set the needle just only 1 mm. 1 mm ready, then I'll do the forehead treatment.
Nãy giờ là mấy
Again,
báo cáo viên
10
của
to 20%
Thái Lan
overlapping, scatter around. You can go from the hairline to the eyebrow.
Good morning, doctor.
Hello, hi.
The plasma patients that you showed earlier in your presentation, did you also combine it with signals or other surgical agents?
See, just only the needle alone.
Okay, very nice results. Just with it's a
Mono treatment, yes. Now we already finished the 3 passes on both cheek and 1 pass on the forehead with the 1 mm needle. For the nose, 1 pass with the 3 mm needle. You can do, if you want, then another neck for the 1 mm needle as well. So I will finish this. Lastly, we can clean all the like a little staining of the needle blood. Checkเลยฮะ
So when we we have a good, even very small group because of the yes, what do you think about after we finish so the one is there, we put the chemical this state of the moon. And in mind, I think only one thing that, but we have to keep everything around with the breathing, and very much if we use we say that because everything from patient. So
Confused. Yeah, I think
Very good question for the sterility, for the cleanliness of the procedure. As you see, when we wipe off the amla, I'll use the chlorhexidine normally, the pink disinfectant, not the alcohol alone, the chlorhexidine solution. We wipe it 1 time and I'll do the whole treatment Then I'll do the chlorhexidine, wipe it again to clean it and wait for a while. And then you can apply the PRP or the mesotherapy because all the mesochemical, growth factors, exosome, anything is already sterile in the vial. So after that, then you, or even the vitamin C ampoule, scratch it, and then I drop the hand with the glove and lightly blending the whole surface. So now until this is sterile. And then I wait, if you want to combine lastly with the chemical peeling, then after 5 to 10 minutes, you wipe it off, clean it again, and lastly with the chemical peeling. Chemical peeling, I still prefer not too strong, not like a 25 TCA, no, that too strong. Use lighter one. The lighter one I'm using is the Miami peel with the lighter chemical, lower percentage of the lactic acid, resorcinol, a little of the salicylic acid. That is a fine.
Không mất hứng.
It won't hurt your needs. The needle pores already closed. It closed. It closed. When you touch the skin that now is smooth skin.
Maybe we have to
Make sure that the sterile.
Yes. Peel is already dry because it is acid. It is already the acid. So there is no any like a bacterial contamination. No, because this is the acid. So it's quite a sterile by itself.
Okay, that's right.
Right.
Nhờ cũng được.
Kneading alone, no exfoliation, almost none. Just only minimal redness, and that's it. But if you combine with the chemical peeling, of course, there will be some exfoliation, minimally.
Are there any more questions?
Visit our school here. If you have any further question concerning the course, a message.
Thank you so much, Dr. Kaitan, for your wonderful presentation and demonstration. So now this is our lunch break. Lunch break takes us out of this room. And see that.
Demand.